Hi, Professor Myers, it's Brandon. Here's my school ID before we begin. And I will be doing a newborn assessment. We'll call her little baby Rosemary. So the first thing I'm gonna wanna do when I enter the room, of course, introduce myself to the mother, let her know that I'm gonna be performing a head to toe assessment on the baby. I will first verify the identity of the baby. So I'll be checking that with the mother's ID band and however the facility and floor protocol verifies their identity. When I go to the baby's basin, so pretend there's a basin here, I'm gonna check for safety first. I'm gonna wanna make sure that they're not placing any stuffed animals in the basin or crib with the baby and provide education if I need to. I will perform some hand hygiene really quick and put on some gloves. So while I'm here, I'm gonna check the baby's level of consciousness. So this baby right now is quiet, alert. So she's awake, but she's kind of just looking around. I'm gonna check if she's in any pain, and crying does not equal pain. I'm gonna wanna assess with something like the FLAC scale. And what that's gonna look for is like the baby's crying, if they're consolable with the crying, their facial expressions, if they're moving their arms and flailing about. But this baby, Rosemary, does not appear to be in pain. I'm going to check the baby's temperature using a thermometer. So I'll pretend I have a thermometer here, and I will be taking an axillary temperature under the arm like this. Let me see if I have something to use as a thermometer. Let me use this. So this is my thermometer, and we will go under the baby's arm like this and carefully hold her arm under, and we don't want to shove it up and hurt the baby, just be careful. And a normal temperature for the baby axillary would be 97.7 to 99.5 degrees Fahrenheit. All right, so next thing I'll do is auscultate the baby. I'm gonna listen to the apical pulse, and I'd be listening for a full minute. So I'd take the small part of the stethoscope and I will listen for a full minute. And a normal pulse would be 110 to 160 per minute. I won't actually do it, but I would do it for a full minute in real life. From here, I might as well listen to the lung sounds, and it'd be easier to listen from here to avoid the heart sounds interfering with the auscultation of the lungs. And it sounds like everything's clear. While I'm here, I can also count my respirations for a full minute, and 30 to 60 breaths per minute is within a normal range. I'm also going to listen to baby Rosemary's bowel sounds, just like I would with an adult. And she should have bowel sounds. And it sounds like bowel sounds are present in all 4 quadrants. All right. Now looking at baby Rosemary's head, whenever I lift her, I want to support the neck always. And I'm going to look at her hair and feel gently at the sutures and her fontanelles. So her coronal suture would be going this way, and her sagittal suture would be going this way. If I see any depression in the fontanelle or it sinking, it might be signs of dehydration, so I might want to assess a little further with that, but everything's within normal limits for baby Rosemary right now. I'd also look for any molding, so the cone head, but I would never say that around the mother, just any molding, and if it was there, that's normal. That's just the head, I guess, molding so that it can come through at birth. Next thing I'm going to do is take a look at baby Rosemary's eyes. I'm gonna pretend I have a pen light right now, and I would shine it in her eyes to check for perla. And I would not force the baby's eyes open. And looks like her eyes are perla. I would also check her ears, and her ears are gonna line up with her eyes. And I'd also be looking for any skin tags on the ears. Just like you said in class, if there's skin tags or abnormalities in the ears, we might expect issues with the kidneys since they develop at the same time. And I'd want to report that to the physician. And also, you know, check for any wounds or any abnormalities, and everything's good with baby. I'll take the pen light and check her nose for any obstruction. I'm also going to occlude one nostril at a time to check for patency and make sure she's breathing okay. When it comes to her mouth, I'm going to check her palate, and I feel that. And while I'm in here, if she starts suckling, that's basically testing her suckling reflex. While I'm up here, I'll check her rooting reflex, and if she turns her little head towards my finger, then it's a positive rooting reflex. I'll move on down to her neck to check for any webbing. And then when we get to her chest, I'm gonna remove baby's clothes. All right, so I can check her skin color and skin tone. And at the same time, I'll also be checking for her chest expansion. It should be equal. And looks like everything's good. I see no abnormalities with her skin or her breathing, her chest expansion. With her arms, we're gonna want them flexed, and we can also check her range of motion with the arms. While I'm here, I could also check her brachial pulses, which should be equal bilaterally. Everything's good. I'm gonna count her fingers, 1, 2, 3, 4, 5. 1, 2, 3, 4, 5, so that's 10 total. And while I'm here, I can check her palmar grafts. So I'm gonna put my fingers here, and she closes her fingers tightly around mine, super cute, and a positive sign on the palmar grasp. I'll continue to move down, and we'll check her legs really quick. I'm gonna count her toesies, 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. And I can check her plantar reflex, same thing as with the palmar grasp. I'm gonna put my fingers here, and her toes should curl towards it. And I'm also gonna check Babinski's reflex. So up this way, and her toes should kind of fan out. And I'll do it on both. And they fan out, everything's good. I can also check her leg length too for any hip dysplasia and report that if applicable. Next thing we'll do is open her little diaper. And for a female baby, the labia majora and minora should be well formed and her clitoris covered. Any white discharge is not abnormal. And if we see a little bit of blood, that's called pseudomenstruation, and that's okay if it's within the first few days of birth. If it's a few weeks down the line, then that's something different. With a boy baby, we'd want to check the penis and the meatus to see where it is. If it's hypospadias, or I think it's epispadias. We'll also want to check the testicles, so we'd feel the scrotum for the testicles, which would feel like little marbles. And also we should keep it covered because the baby might spray. We'll also consider a bowel assessment. So we're looking for a meconium, which is the baby's first stool or first bowel movement, which we should expect within 12 to 48 hours of birth. We should also check for any signs of urination, the wet diaper, also within 12 to 48 hours of birth. So I'll go ahead and put Rosemary's diaper back on. We want to check the umbilicus, the umbilical cord, for any redness, swelling, drainage, or bleeding, and it should be thick and shiny. And like you mentioned in class, we don't want to be constantly bathing that. Baby can have one bath after birth, and we'll leave it at that. Otherwise, we might make that umbilical cord really wet and gooey and nasty, and it can get infected. So we'll go ahead and check baby's back. I'm checking her spine curvature and for any Mongolian spots, the birthmark. And if I see a sacral dimple or any hair, that could be spina bifida, I believe. So we should notify the physician for that abnormality. And looks like baby Rosemary is good. And I'm also gonna wanna check her stepping reflex. So we'll hold Rosemary up like this, and her legs should move like she's walking, super cute. And then we'll put her down and check Moro reflex. So I'll pull her up a little bit, just a little, and we'll drop her gently. And there's pillows here, or not pillows, but you know, she's on the basin, so I'm not dropping her on a hard counter. And when she drops, she should do that embrace reaction where her hands kind of sprawl out and she looks like she's trying to give you a nice little hug. All right, so everything looks good with baby Rosemary right now, so I could replace her clothes and ask the mother and the father, and if they have any questions for me, and document appropriately. Of course, we'd remove our gloves and dispose of them properly and perform hand hygiene before leaving. And that concludes my newborn assessment.